I receive patients from the OR at their most vulnerable time, and I return them to their loved ones safe and sound. I pride myself on being an advocate for my patients, my coworkers, and yes, for myself if needed. There has been a sea change at legacy hospitals. Management at any level does not want to hear from advocates. They want absolute control and want all employees to agree absolutely with all decisions, good or bad, safe or unsafe. Also, human resources no longer advocates for staff. They become another arm of management. A respected physician was told by the administrator at SAM that if he, the physician, didn't have anything positive to say, he should get out of the administrator's office. The physician responded with, "I thought you'd like to know when things aren't working." Apparently not. In the last few months, I've personally learned of 6 department managers who were terminated for being nurse advocates. One of those was in March and was my manager. Her boss was recently promoted to director of surgery. She had been a manager in the ICU, where she had provoked numerous complaints from staff to human resources. She fired many top-notch nurses there. As surgical services director, she fired more top-notch nurses. I was one. I have been chastised and written up for advocating for safe patient care, safe patient assignments, and safe staffing ratios and hours. On the most recent occasion, I was asked to violate my standards for safe care. I protested that my assignment was unsafe, and I was terminated as a result. ASPAN, the American Society of Post-Anesthesia Nurses, is a professional organization that dictates best practice for nurses in PICU. ASPAN states that a patient is to be one-to-one care for the first 30 minutes of PICU stay. Generally, after the first 30 minutes, the patient is stable enough for the nurse to take another patient, but not always. Some patients are never stable enough to stop being one-to-one or more. It is highly unpredictable, no matter what the surgery is. My job as a PICU nurse is to literally save a life with every admission. My patients are absolutely dependent on me for their survival. Continued monitoring of a patient's respiratory status is essential, especially the first 30 minutes. A patient's breathing can be severely compromised for a variety of reasons: unconsciousness, muscle paralysis from anesthetic agents, obstructed airway, vomiting, lung disorders, and more. Anesthetic agents can have negative effects on the cardiovascular system. Patients can have dangerously low or high blood pressures that need immediate attention. Patients can have metabolic imbalances or adverse reactions to drugs. These and many more problems can lead to serious repercussions, potentially even respiratory or cardiac collapse. The first 30 minutes are critical. Patients, even healthy ones, can arrive unconscious, hysterical, confused and agitated, emotionally needy, or in severe pain. In that first 30 minutes, report from anesthesia is received, the patient is assessed and treated, the chart is reviewed, orders and medications are implemented, and documentation is initiated. We all would want a trained, competent PICU nurse at our loved one's bedside, giving that loved one undivided attention, especially the crucial first 30 minutes. My direct supervisor demanded that I admit a second new post-op patient after just receiving a report on my first new admit from OR. I protested 3 times. Each time I was told, "It'll be okay." When I asked for an explanation, I was told, "It'll be okay." I was subsequently fired for protesting an unsafe patient assignment. On the day that I was fired, my evening charge nurse went with me to the meeting. She begged them not to fire me, stating that I was a much valued, experienced, and needed nurse for our department. My peers at Kassan PICU have told me that I am the gold standard for PICU nursing, and that I always gave 110% to my patients and my job. If they can fire you, Debbie, they said, they can fire anyone. Anesthesiologists were stunned at my termination. One recently called me at home to tell me what a loss to the department I was. He said, "Debbie, you taught me how to be a good anesthesiologist." I was fired from a job that I loved and was good at, for speaking up for safe patient assignments and care. Thank you.